Hey everyone! So today we're going to talk about a global health issue that hits nearly 2 billion people every single year. But here's the amazing part. One of its most powerful solutions is literally just a simple mix of sugar, salt, and water. We're diving into the world of diarrhea and dehydration, and trust me, it's more fascinating than it sounds.
Let's start with a number that just stops you in your tracks, 9%. Think about that. That means that for children under 5 around the world, almost 1 out of every 10 deaths is caused by diarrhea. This isn't just a stomach bug. For so many, especially the most vulnerable, it's a very real threat to their lives.
So, to really get a grip on this, we've got to define what we're actually talking about. What exactly is acute diarrhea, and why is it such a massive problem? Okay, so this is the official definition from the World Health Organization. But here's what's really interesting, and what doctors will tell you. The change in consistency is actually way more important than the exact number. That sudden shift to loose, watery stools, that's the real red flag.
1.7 billion. I mean, just try to wrap your head around that number for a second. That's almost 1 in every 5 people on the entire planet getting sick with this every single year. It shows you this isn't some rare thing. It's a constant global health battle.
But here's where the story takes a really important turn. You'd think the infection causing the diarrhea is the main problem, right? Well, that's not quite right. The real villain here, the thing that makes it so dangerous, is something else entirely: dehydration.
And this is absolutely crucial to understand. It's all about the rapid loss of water and essential salts, electrolytes. The best way to think about it is to picture a plant. If you don't water it, what happens? It starts to wilt, right? That's basically what happens to the human body. Every organ, every system starts to fail, and if you don't fix it fast, it can be fatal.
Okay, so this leads us to maybe the most practical, most important part of this whole thing: how to spot the signs. Because knowing the difference between someone who is a little dehydrated and someone who is severely dehydrated can, and I mean this literally, save a life.
This chart just lays it out so clearly. On the left, with some dehydration, a person might be restless, irritable, and really thirsty. They'll drink whatever you give them. But look at the right column. Severe dehydration? That's when they become drowsy, lethargic, maybe even unable to drink at all. And check out the skin pinch test. It's such a simple, powerful tool. If you gently pinch the skin and it snaps right back, that's great. But if it goes back slowly, taking more than 2 seconds, that is a major warning sign. That means it's a medical emergency.
All right, so now let's talk about the hero of the story. Faced with this enormous, deadly problem, science came up with a solution. And it's so cheap and so simple, you'd almost think it couldn't possibly work. It's called oral rehydration solution, or just ORS. So where did this brilliant idea come from? You might be picturing a state-of-the-art lab somewhere, but the real story of ORS wasn't born in a sterile environment. It was forged in the middle of a massive, desperate humanitarian crisis.
Picture this. It's 1971. A terrible cholera epidemic is tearing through refugee camps. The only treatment they have is IV drips, and they've completely run out. People are dying, fast. Amidst all this chaos, an Indian doctor named Dilip Mahalanobis makes an incredibly brave call. He knows from research that adding sugar to a salt solution can help the body absorb water. So, with nothing left to lose, he starts mixing this simple solution in giant drums and giving it to his patients to drink. The result was nothing short of a miracle. The death rate in his camp dropped from a horrifying 30% all the way down to just 3.6%. He proved, under the worst conditions imaginable, that it worked.
And don't underestimate how huge this was. The famous medical journal, The Lancet, called this therapy, oral rehydration therapy, potentially the most important medical advance of the 20th century. I mean, wow, that puts this simple packet of powder right up there with things like antibiotics and vaccines. It was truly revolutionary.
So what's the science? How does it actually work? Well, it's pretty brilliant. The glucose, the sugar, basically acts like a helper molecule. It grabs onto sodium and water and pulls them through the intestinal wall, getting them back into the body where they're desperately needed. It's like a biological hack that makes drinking water super efficient for rehydration.
Now, as amazing as ORS is for treatment, the best-case scenario is always not getting sick in the first place, right? And just like the cure, the methods for prevention are surprisingly simple, common-sense public health actions.
So here are the big ones. And look, it's not rocket science. We're talking about access to safe drinking water, proper sanitation, simply washing your hands with soap, vaccinating babies against rotavirus, which is a major cause of diarrhea, and just general good hygiene. These basic things are our absolute best line of defense.
So I'll just leave you with this question. We have this tool, it's simple, it's incredibly cheap, and it has saved millions and millions of lives. But when kids are still dying from dehydration, you have to ask, are we really using this modern medical miracle as much as we should be? It's definitely something to think about. Thanks for tuning in.